In April, close to 4,000 people came together in Atlanta for the largest gathering in history to combat our nation's deadly opioid epidemic.
The epidemic that I find to be the epidemic of our time is, in fact, the opioid epidemic. Hard to believe 70,000 people lost their lives from drug overdose, and the loss of life continues as we sit here today.
In response, a Kentucky organization called Unite stages the National Prescription Drug Abuse and Heroin Summit, which has brought together dedicated advocates and problem solvers from every corner of our country and some foreign countries for 8 years in a row to learn, to share, and to take decisive action to save lives.
Everyone here today is united by the same vital goal: to liberate our fellow Americans from the grip of drug addiction and to end the opioid crisis once and for all.
The Prescription Summit attracts people from every walk of life, reflecting the reality that opioid abuse and addiction is a multifaceted problem requiring a multi-pronged solution.
The stigma needs to stop. You need to share your story. I wear 2 bracelets every day since my son's death. On my right wrist is a purple bracelet to honor those who have fallen for drug overdose, has his name on it, and date of birth and date of death. On my left wrist, I have 2, thin blue line. And I've got another one that simply states, every overdose is someone's child. Don't judge, educate.
From federal officials to impacted families.
This is my mom, and we're a family in long-term recovery.
For 4 days each year, we come together to learn what is working in prevention, treatment, and law enforcement.
We want to mainstream the training on addiction medicine in the United States. Addiction is such a prevalent illness. No healthcare practitioner should graduate without a basic background in addiction training.
In 2019, the conference featured briefings from President Trump and the First Lady as well as the head of all the federal agencies collaborating to tackle the problem: ONDCP, CDC, NIH, NIDA, SAMHSA, Coast Guard, and DEA, among others.
We will continue to raise awareness of the dangers of opioids to unborn babies. We are also committed to supporting more treatment facilities that help both mothers and babies recover and replace the bond of addiction with the bond of love between a mother and her child.
In an average year, your U.S. Coast Guard seizes twice as many drugs in this transit zone as all the other law enforcement agencies in the country put together. It's just that we catch it in bulk. Every kilo of cocaine that we take out of their profit stream is directly affecting our relatives and children in Kentucky and Alabama and Arkansas and North Carolina and everywhere else you're from.
Along with these federal leaders, to include members of the United States Congress, the summit has a dozen tracks with hundreds of breakout sessions for attendees to collaborate and share best practices across many disciplines. Counselors, social workers, therapists sit by side with first responders and law enforcement personnel. Drug court judges hear from prescription drug monitoring program administrators. Public health and prevention officials exchange their ideas with education specialists and treatment professionals. Researchers and doctors engage with families and people in recovery. It's truly an all-hands-on-deck approach, and this cross-collaboration is the linchpin of our efforts to address opioid abuse and addiction.
They took a chance on a broken and bruised person who had been touched by the system, but they knew that I had a purpose, and my purpose was to use the pain that I went through to help other people not have to go through the same thing that I went through. You see, recovery is real. We do recover. We do recover.
Though the Prescription Summit had modest beginnings with 700 people in 2012, it has grown every year to become the preeminent national event focused on the challenge of our time. It is the one venue that brings all of the necessary puzzle pieces together in one place, and some groundbreaking announcements have been made over the years. For example, the CDC has reported a reduction in opioid prescriptions nationwide for the last 8 years in a row. The FDA has made critical labeling changes and incentivized abuse deterrent formulas. More drug courts and treatment facilities are available than ever before. Over the last 2 years, our national prescription drug take-back days have collected nearly 3.7 million pounds of prescription drugs, and record levels of federal funding are being invested to attack the epidemic from every angle.
There's no question in my mind that science is going to provide new solutions that we can't even imagine right now. And ending this epidemic is in fact very, very possible. And I think working together will do just that.
If we, governmental and non-governmental agencies and individuals, could work together in partnership, Congressman Rogers knows we can stem the tide of this dreadful scourge and be a light in the darkness.
This model for collaboration is an outgrowth of an organization that we launched to address the problems my congressional district confronted in the early 2000s when the Oxycontin Bomb exploded. One of Kentucky's largest newspapers, the Lexington Herald, published a comprehensive investigative series entitled Prescription for Pain, detailing how more Oxy was being prescribed per capita in southern Kentucky than anywhere else in the country. That's when my home region became known as the painkiller capital. That's also when Eastern Kentuckians united to drive out drug dealers. We also offered addicts free vouchers to enter treatment programs and began educating our community about the overdose dangers of these powerful painkillers.
Congressman Rogers formed Operation Unite, which pioneered a holistic approach that has become a model for other states in the nation. UNITE is an acronym for Unlawful Narcotics Investigations, Treatment, and Education. It started with a few dozen UNITE employees. It spread to thousands of volunteers, provided more than 4,500 people with treatment vouchers, reached more than 260,000 youth with prevention and education efforts. Because of the leadership and the action of Congressman Rogers, hope is being restored in the painkiller capital of the nation.
Congressman Hal Rogers knows and lives the power of we. His faith rests in you. He believes if we could bring together those with the best ideas, tempered and forged by experiences in the real world, and driven by the fundamental principle that those we serve who battle this disease deserve our support, not shame and stigma. He knew if we did all that we can outrun this epidemic.
So let us resolve that together we will support, cherish, and care for our fellow citizens through every step and every challenge on their road to recovery. We will reach out to anyone who is hurting or lost or struggling, because every American deserves to know the glory of hope, the joy of belonging, and the blessings of healing. And we will fight for the day when every family across our land can live in a drug-free America.